that happen to be radio opaque. And let me see if I can zoom in on it. Because I even had to sound like, wait a minute, that's not right. I don't know how this is going up here. All right, can you guys see that? You see the little ligatures and all that? All right, so this dog had some surgery. It may have been when she had her spay, or she may have had some other abdominal procedure. But now she has to go get those trimmed and go back in and get these guys out. And you guys see how these are kind of stellate? Okay. And so those are beautiful. Bad for them, but beautiful for us. All right? Cool? Okay. So, not only are we looking in the urinary bladder, we're going back up the tract, and we're going to make sure there's no calculi or mineralization in the kidneys or in the ureters. All right, so when we talk about nephrocalcinosis, it's just a long word for saying kidney stones. Okay? But remember, we're not supposed to say stones, even though we talk about that in human medicine. All right, so calculi or mineralization in the kidneys. So when you hear the staghorn calculi, you think of a stag. All right? So this is as best I can represent, because when I first heard this, I was like, what are we talking about? I know nothing about this life of staghorns. Because I don't see them on a regular basis. But what you're seeing is kind of, excuse me, this broadened area. They might look more, what is it, the moose that have the thicker elk, thank you. I might need to have her put the elk's horns on there instead, because that's more or less what they look like, because they're causing that dilation. And so you can kind of see here. Y'all talking? It's confusing, I know. Let me see. Uh-oh. Go back. Stay. Let's see. This is a survey film. Running forward. There we go. So what you're seeing on this survey film, no contrast needed. You have this mineralization. It's bilateral. It's in the area of the kidneys. Okay? You can actually see the caudal of the right kidney here. You can barely make out the left kidney in this area. But when we see that mineralization, one, we're looking at it on the lateral. We're looking at everything else around it, and we're making it kind of make sense anatomically. Where could these be positioned at? And given their anatomical position, these are more likely in the kidneys. So to confirm that, we're going to do a contrast study, the IVP, and we're going to see the filling defects around it. All right? Everybody okay with that? All right, so some more nephroliths. So these are going to be more common occurrences. You'll see these like little ventral opacities in the retroperitoneum. All right, they're just kind of hanging out in there. A lot of times they're incidental findings. The pet doesn't really have any type of abnormalities going on, but it is notable when you see it, because you may be the first doctor that says, hey, Fluffy has some mineralization in their kidneys. We're going to need to be mindful of that, because now I'm going to check his blood work, make sure we don't have any early signs of renal disease, and we want to make sure that we're not developing crystals or stones, calculi. See how I correct myself? Calculi in the urinary bladder that will eventually cause any type of obstruction or further disease. So always cover yourself. This first picture is a very exaggerated presentation of such. You guys see the mineralization here? And then this one is very subtle. Okay? Yeah. All right. We got 5 minutes. So other filling defects in addition to calculi are going to be that of air bubbles. So we might have air bubbles when we're getting the double cystogram. Okay? That's why we got to push it a little slow. You can have blood clots, because how many times do you have hematuria? You can have the calculi, like we've already talked about. And so the calculi, because they are going to be heavy, they're going to kind of sink. All right, so they may be up along the bladder wall, or they're gonna be, so this patient, we have a double cystogram. So you see the neck of the bladder here. It's sinking within the puddle of the contrast material. Remember, this dog or cat is laying on its side. So that contrast material is gonna fall to the bottom, or whatever side is dependent on the table. And those calculus, or calculi, are gonna kind of hang out within that material. All right? Whereas the air bubbles are gonna usually be around the periphery. Okay? They can sometimes be in the middle, because maybe we kind of caught one in there. Blood clots are gonna be irregular. They're gonna have indistinct borders. Okay? These guys can be attached to the bladder wall, they can be in the center, they can just be floating around. All right? But the key thing to remember, air bubbles are gonna be nice and round. They can be in the middle or in the periphery. Blood clots are gonna be irregular. Calculi are gonna have various shapes. Sometimes they're smooth, sometimes they're stagate, or what is it, stagate? Where they look starry? Stellate, thank you. I'm thinking staghorn, words in it. All right, and a lot of times they're gonna be in that puddle, okay, of contrast material. Cool? So pelvic bladder, really quickly, we've already talked about this. So this is one of those situations that can be congenital. And what happens is that bladder easily slides into the pelvic canal as it fills. Now when she's empty, this is most commonly in female dogs, when she is empty, she will look like she's in a normal position. But as she fills, it looks like the water balloons, right? Everybody remember those water balloons that look more like a pear? Mm-hmm. So that's what she's looking like here. And so sometimes what that is that we have a shortened urethra, okay, or we have some other abnormality with the urethra. All right, so again, this is something that can be congenital, and it can be associated with USMI, urinary urethral sphincter mechanism incompetence. Okay, pelvic bladder. We typically look at this, we can look at this on fluoroscopy, or we can most often get our diagnosis, and we've done one of these within the last couple of years, or last year actually. I think it was the second year, or maybe one of, or fourth year. I'm trying to remember. I think it was either fourth year or second year dog actually had this condition, and we were able to do a cystogram to confirm. Okay? Pull on pelvic bladder. A lot of times you're going to see, you guys see the urethra? And it's going in. Sometimes you can see where you have ectopic, I said urethra, ureter. Sometimes you can have ectopic ureter as well with these conditions. Mm-hmm. And so that's where you have some of those urinary incontinence problems that they're experiencing. Okay, so if you have a hernia that includes the bladder, and I believe we have one of these recently, sometimes you can just place the probe on there and you can get anechoic cavity. You can aspirate, you get back urine, or you can just simply do a contrast study and see the filling defect. All right. Urethral rupture. We see that most commonly when we have either an obstruction and it's been there long enough and the dog is trying to keep pushing, or in filling or in placing the urinary catheter, the urethra has ruptured. Okay, these are a focal view of calculi within the urethra. I see the filling defects. Again, that's that picture. Hold on, how many do we have to this time? Yes. All right, let's quickly go through these and then, no. All right, so vaginal urethrogram, that's one more study that we can do in the females. A lot of times we do this one when we're looking for ectopic ureters or we're looking for that pelvic bladder, okay? So with that particular patient that we did with that ectopic pelvic bladder, we did a vaginal urethrogram. So what happens is that you Place a Foley balloon catheter right there in the vaginal canal. What happens is the vagina gets filled as much as it can before you start getting that retrograde filling of the urethra, and the kind starts getting into the urinary bladder. So now you're able to see the vagina, which sits dorsally to the urethra, and now you see that opening there. Okay, so you can visualize any defects or any any location or abnormal location of the ureter going into the urethra, or wherever the pelvic bladder, or wherever the bladder is, be it in the pelvis or in its normal location. Okay, I'm just moving. All right, so this is a urethral neoplasia, and so you see those filling defects and those irregularities around that area, and so that's what you're seeing, or what you're able to pick up on a vaginal urethrogram as well. This is also helping you to look at the USMI. Okay, these are air bubbles that were introduced by accident. All right, and then that's it. That's your message from Dr. Perry.